Narcotic addiction is not just a problem on the streets. Research indicates that every year, 70 million patients will receive narcotics following surgery, and 1 in 15 of those patients will become long-term users. Joining us to talk about the new Voice Your Choice campaign, noted surgeon Dr. Kristi Funk. Good morning, doctor.
Good morning, Mary.
What's fueling this national epidemic, especially among women?
Well, healthywomen.org conducted an online survey trying to figure out the answer to that exact question. And what they discovered is very revealing. So over 700 women answered questions about their post-operative narcotic use after surgery. And 90% of them had said that they understand that narcotics can lead to addiction and they'd rather not use them at all, and yet 80% of them did use them. And secondly, unanimously, they said, I'd like to be a part of the conversation in planning my postoperative pain management, yet over 70% of them never had a single discussion about it. And I think that's the key. I think addiction is happening because women are not asking questions on the front end about the pain control plan. So on the back end, they're just getting this prescription and they're in pain, so they take the pill, and a percentage of them will get addicted.
Is this an issue for men as well?
Narcotic pain pill addiction is absolutely men and women alike. So it's just that the trend in women is escalating faster than men, so it's caught our eye.
Well, you mentioned patients not talking with their surgeons in advance. Why do you think these conversations aren't happening?
Well, I think conversations don't happen in part because patients, women, aren't prepared with what questions to ask their physicians, and they don't want to be threatening or off-putting to their surgeons. But if you go to healthywomen.org, the Pain Center has some tips and scripts and questions that are really easy and manageable and simple to ask your doctor. So basically you just want to say, hey, how much pain do you think I'll be in after this operation? How long will it last? And what's the plan to control it? And then I would suggest that you ask about non-narcotic options, because there are many.
You know, some people might be intimidated by the idea of facing recovery without narcotics. What's your advice to them?
I would let them know there's something called multimodal therapy, whereby a number of medications are given immediately prior, during, and after surgery that can control your pain so well that you'll be very limited in the need for postoperative narcotic. It doesn't mean that you can't take any, and if you're worried about it, you can have a prescription in your back pocket, but know that this multimodal therapy can be so effective that the need for a narcotic after the fact is very minimal.
We mentioned the Voice Your Choice campaign. Where would you send our viewers for more information on that?
Go to healthywomen.org to learn more about how you can voice your choice.
An important topic to be informed about. Dr. Funk, thank you.
Thanks again.